With me now is Reena Aggarwal, a junior doctor. Thanks very much indeed for being with us. You were telling me a little bit earlier that you were on strike today.
Yes.
This is the third. Is it getting you anywhere?
Yes, it has got us somewhere. If you look at the junior contract that was first proposed in the autumn and where we are now, we've actually achieved quite a lot. And it would be disingenuous for junior doctors to actually say that the government hasn't shifted either. Probably in the current imposed contract, 90% of what is actually in the contract has been agreed. However, there is 10% of that contract which is still under question, and why junior doctors today went on strike. We believe that the 7-day working mandate is unsafe for patients.
But you say there's just 10% of this deal that needs to be sorted out. That still leaves a 24-hour strike through tomorrow, 2 more 48-hour strikes, and patients whose operations have been cancelled.
I'd like to say I'm very sorry to every single patient that's had a procedure, an operation or an outpatient appointment cancelled or postponed today. No junior doctor, no doctor wishes for that to happen. I didn't enter into medicine to withdraw my labour. However, the government are forcing us into this position. You can't have a 7-day NHS on the funds for 5 days. The government has come in on a mandate of wanting a 7-day NHS. The problem is it's uncosted, it's unmodelled and it's undefined, and this is the issue that we're trying to speak to the government about, but then denying us the opportunity. If you want a 7-day NHS, absolutely, Mr. Cameron, fund your 7-day NHS. Today, Dr. Phil Hammond, who's the Vice President of the Patients Association, he himself says this is not a dispute about Saturday pay. This is a dispute about safe staffing. If you want safe staffing, you need safe rotas and you need safe numbers of people on those rotas. We currently already struggle from Monday to Friday to provide a good emergency and elective service with the number of junior doctors.
All right, you've invoked David Cameron's name there. Are you saying that this goes beyond Jeremy Hunt now? That, you know, talks with him have broken down, there's no faith there as far as the BMA and the Department of Health is concerned. Now David Cameron's got to step in.
Yes, I do. I think 54,000 junior doctors have lost all faith in their Secretary of State for Health, and I think it is now time for the Prime Minister of England to step in and actually put a stop to industrial action and to imposition of this contract. My suggestion is let's press pause on imposition and on industrial action, and let's get round the table and actually let's stop patients having their operations cancelled. Let's stop junior doctors like me going and standing in the cold on picket lines. I would much rather have been at work today, and I would much rather be at work tomorrow. I have no desire to be on a picket line. I chose to become a doctor because I have a vocation. I chose to be a doctor when I was 4 years old. I have no interest in striking. I have interest in ensuring that we have a safe NHS for the future.
All right. Okay. Reena Aggarwal, thanks very much indeed for coming in. Reena. Thank you.